Great. Hi,
Hi, Dana. How are you?
I'm great. I'm here today with Marelda Rodrigues. We're going to be discussing supporting ourselves through perimenopause and menopause. I'm so excited to be having this conversation with you. So, can you start by telling us a little bit about who you are and what you do?
Sure. I was introduced into your world through massage therapy, which was my primary wellness entryway, if you will. And I've been a massage therapist for about 26 years, and along the way became a functional medicine health coach. Have been health coaching in general almost, I don't even know how long, but I would say at least over a decade. And really wanted to hone into something particular that would excite me as much as massage. And that turned out to be initially grief work, but now when I go deeper into grief work, it became menopause based on my personal experience in menopause, as well as the different griefs that show up that are a little more fine-tuned than, say, the other griefs that are not involved with menopause.
Mhm. Okay, that makes sense. Yeah, because when we first met, it was through the context of grief massage and trauma informed care. And so it's so exciting to see how you've transitioned into something that is adjacent, but even like a little bit more refined. So, yeah, I'd love to just ask you some more questions about your work. The first thing I want to ask is why is it important for us to learn about and prepare for perimenopause and menopause before it happens?
I just will give you a simple metaphor, and that is you always want to have the fire extinguisher before the fire.
Yeah.
Unfortunately, because of a few hiccups along the way, one being that menopause is not a focused piece of education for even gynecologists. They don't get more than 6 hours.
Is that true?
Yes,
Oh my
there's
gosh.
enough gynecologists on Instagram that will tell you that. So the
Wow.
main focus in gynecology is it's women's health, but it's more front loaded with coming into puberty, having periods, getting on the pill, um, um, more of pregnancy, like how, prenatal care, coming into pregnancy, maybe multiple births or a breech birth or, the actual birthing process, and then some smidgen of postpartum care. And then the general sort of like, your pap smears and your general health. So until almost 2 years ago, there wasn't this rebirth. So there used to be until 2002 there used to be some education that was a little more than what there is now. And in 2002, just very briefly, there was a study that came out. There were some things that didn't align properly. The subjects used were older. So they didn't really have a lot of people earlier in their menopause journey to actually get good data on.
Mhm.
It was then misinterpreted to suggests that the hormone therapies that were out there were going to lead to breast cancer. And so everybody freaked out. And then they put the lid on it and stopped talking about it altogether. So a whole generation of women has gone by who are now in their 60s and 70s that are asking me questions that perimenopausal women are asking me, or there are some things that are irreversible, certain things that they're going through that
Mhm.
they could have handled on the front end and
Mhm.
had different outcomes possibly on the current stages that they're in. So, all this to say, I have started, when I first started talking about menopause and I found out about all of this, it was really to sound a sense of urgency. And I am, even in massage, I have a very conservative approach. So my conservative approach is don't wait till 40, start at 35. And,
Mhm.
and if you look at the timeline of 35, most women are just having their child or having their second child. They're still being young moms, right? And they're probably some women are having their babies even in the 40s. So that is not a reason to not know what's coming up, because the body and Mother Nature don't just say, hey, you'll get a memo in the mail
Ah.
notifying you that this is your menopause date. So after this, come to the meeting and you'll be given an information session. There is no such thing. Nobody tells us what's going to happen in puberty. All of a sudden, some 10-year-olds and 11-year-olds and 12-year-olds are going through all this transition and their hormones are crazy. They're going into a period, their breasts are developing and they're freaking out. So it's almost like a second version of puberty. And it has been called sometimes the second puberty
Mhm.
for this reason. But here's what's also happening is so many things that women don't plan for because they're so caught in the parenting or their career pieces, um, that they don't really understand that what's going to come down with very little room to breathe is becoming an empty nester, caregiving for older parents, um, spousal changes, meaning in their relationship, or a spouse might be older and have some um, health issues related to aging. So all of these come fast and furious. And then menopause in and of itself creates a lot of women starting to come into their own when they're not ready. And they're like, I
Mhm.
don't like this anymore. I don't want to go here anymore. I'm so tired. They start to feel guilty about wanting to rest. They feel shamed about feeling certain things, changes in their actual anatomy. Um, they have no idea that there's actual changes. Like if you were to look at a photograph of women pre-menopause and a picture of post-menopause, the anatomy is different.
Mhm.
Some places you won't see any tissue or it looks really different, and women are ashamed to talk about that.
Mhm.
So this is why I feel like if we can front load this and get women in their 30, late 30s to start looking at it. The other reason why it's important is, for example, I know someone who's been in my world for a long time who had menopause at 39.
Mhm.
And imagine there's no doctor there to talk to her. So she took it into, because she's in a allied medical field, she decided to take it into her own hands. And she said, you know what, I'm just going to continue on the pill, which is not technically the right solution, but she didn't have anybody guiding her through anything.
Especially knowing that doctors aren't really trained in
Yes.
this.
So,
Yeah.
so there's this thing called surgical menopause. So if your uterus is removed, if your ovaries are removed, if you have other ailments like PCOS, all these add layers of complexity.
Mhm. Gotcha. Okay. Yeah, I mean, I feel like what I'm hearing you say is that there's a lack of medical knowledge and attention around perimenopause and menopause. There's a lack of kind of like societal knowledge and attention around it. And so then people just end up being kind of like hit like an oncoming train by this thing that is affecting their body, the appearance of their body, their internal experience of their body, their sense of self, their relationships, the way that they interact with the world. Like it's changing everything and they're completely unprepared for it. So I feel like what I hear you saying is like know that this is coming and begin to prepare for it, because if you begin to prepare for it, then you at least have a leg up on not being like steamrolled by it.
100%, 100%. And also understanding, that not everything is aging, because what I hear, even my massage clients now, I have changed how I talk with them. Uh, when they start giving me, there are specific ailments that come in that massage therapists I feel should know. I kind of, it landed from the ceiling onto my lap and I'm in the know.
Mm.
So I'm just thinking, for example, frozen shoulder. Frozen shoulder is, if you talk to a woman who is in perimenopause, this is a huge sign of perimenopause.
Wow, who knew?
Who knew? I've had hip pain for the last 7 years that nobody has told me about. And I'm like, why is my hip hurting? Why is certain positions uncomfortable that I used to sit in before? Why is climbing up the stairs a problem? And where do I find the answer to this? As I was thumbing through a health magazine, not from a doctor. I've seen 3 female doctors. So letting people know, hey, hip pain, start asking questions. How old is your client? So now, pretty much all my clients, as soon as I see them and I start hearing things, I'm like, can you just give me a sense of how old you are? And I am not
Mhm.
ashamed to say, hey, uh, please keep menopause front of mind. Wherever
Yeah.
you are, I'm not telling you this is menopause. I'm just saying it's coming down the pike. This could be related. I don't know.
Well, that leads really well into our next question, which is how can bodywork support those who are going through perimenopause and menopause?
I think, it's really important. The conversations are really important. Women, this is not a ding against them. This is just an awareness and an observation because I used to be the person I'm about to describe.
Hmm.
I burned out in corporate America. So we have our job stresses and life stresses, right? On the As I was coming out of the burnout was when I started to notice the worst periods ever. Every single month, I was like, okay, this must be a good month. And then it would be worse than the last month. Now that I look back, I'm like, let's wear a big sash that says perimenopause, right?
Hmm.
And so if I could go back now in my mind, I'm thinking the women who talked about the weight gain, the women who talked about the frozen shoulders, the women who talk about all kinds of things that I was like, yeah, it's, I mean, par for the course. But I think what's important now is really understanding what are some of the symptoms so that the therapist has an awareness. They're not diagnosing, but they can include the things as a maybe this is something you should talk to your doctor about. Um, I recently had a client who was talking to me about feeling tired. She happened to, get within a month of me working with her, happened to write me an email saying that she had a breast cancer diagnosis. So her exhaustion could have been related to that.
Hmm.
Um, However, when you have a female client who is talking about exhaustion, aches and pains that seem mysterious, feeling bloating types of things and saying, oh, I'm really uncomfortable. These are some things that, should be somewhere in your reference pages that, hey, these are the symptoms these women could be talking about. Losing balance. I started losing balance. You would think I was drunk. Um, Wobbliness is a
Hmm.
sign of menopause. So they're so subtle. So that's why I say self-education and reading and looking at some of the resources out there and keeping them in your back pocket when women who are in their 40s come to see you. You don't have to jump out and say, hey, are you menopausal? But when you listen to the conversation, you have to put on your menopause ear and listen with that as well.
Hmm. Are there any specific resources that you recommend for body workers to learn more about menopause?
I would say, pick up right now, menopause is such a hot topic. If you go to Amazon and you type menopause, like 100 books are going to come up, and they're all the doctors that I follow. However, I feel like whether you're a male therapist or a female therapist, it is good to read books like